In general, the health care law has not been particularly popular. However, some of the provisions, as they've been enacted, are popular. An example of this is children staying on their parents' insurance until they're 26. Representative Space, you voted against that legislation, stating that it didn't do enough, as I understand it, to look out for rural area hospitals such as we have in this area, among other things. What can the American people expect the next U.S. Congress to do with regard to the health care legislation, if anything, and what would you push for?
Mr. Gibbs.
Well, first I want to be clear on your question. Congressman Space did vote for it twice in the House before he voted against it. You know, you mentioned about the child deal. I'm seeing reports that a lot of carriers now are just wanting to write children, so that's unintended consequences is not good. But what we need to do, we need to repeal what they passed, and we need to reform health care with this in mind. We need to address the escalating costs. It's at the point when nobody can afford it, and how we address the escalating costs and incorporate free market principles in the private sector into it as much as possible. And one is tort reform. We did medical malpractice reform here in Ohio in 2005. For medical malpractice insurance rates, we brought down. We've made it more reasonable for docs to stay here in Ohio and not retire early like they were doing. We need to have portability, apply insurance across state lines, competition. I don't have time to get into medical savings accounts, but we need to have a program like that. I got some ideas on that. And also the medical uninsurable, people that can't get insurance because of medical reasons. We need to encourage the states to do group risk pools and develop with the private sector, and let the states be the laboratories to come up with a solution, because I don't think there's a good solution. But having the federal government take it over is a disaster. It'll cost money. This will bankrupt the country when they pass, and it needs to be repealed because it's going to bankrupt us.
Mr. Space.
Okay. First of all, healthcare is a very complicated matter, and it's a very pressing one we need to address. A minute and 15 seconds is not going to give me the necessary time to do that. I do feel compelled to respond very briefly to the suggestion that somehow or another, if we implement tort reform, we're going to save our healthcare delivery system. It's preposterous. The state of Ohio has one of the most aggressive tort reform laws in the nation. Has had it on their books now for about a dozen years, and the rate of defensive medicine practice has gone up. It's one of the highest in the country. Tort reform is not working, at least the kind of tort reform that Mr. Gibbs advocates for is not working. There are some good things in this bill. You mentioned children remaining on their parents' policy until they're 26. I think that's a good thing. Most people do. The mandate that pre-existing conditions be covered. The limitation on lifetime caps. All good things. My feeling is the bill could have been done much better in terms of how it's paid for, how it keeps the insurance industry honest, and how it keeps costs down. But the answer is not to repeal it and go back to the system we had. The answer is to keep what's good and reform what's bad. And I'll continue to work to make this law better if I'm reelected to Congress.
Thank you. Mr. Sutton.
I would like to see the health care bill repealed. My answer to this is based on the U.S. Constitution. The federal government has no authority by the U.S. Constitution to be involved in our health care. The only involvement that would be constitutional would be to remove barriers from between states to be able to purchase insurance policies for health insurance, like we do so many other things from state to state. Take those type of regulations out. If we want a health care program, I think that the states are where those programs should emanate from. Massachusetts had a health care program, nearly bankrupt Massachusetts, so that their plan didn't particularly work. Tennessee had one, they revised it and it finally worked. But the point about having the federal government take over health care is that if it's, and they have, if the entire country has got to abide by this atrocious law, there's no place else for us to turn. If you lived in Tennessee before, you could move to elsewhere.